We want to catch these changes before they develop into cancer. Okay. Because the earlier detection means that these women will get earlier treatment so that we prevent cervical cancers like this.
We're screening it by detecting the HPV, which is human papilloma virus that may cause cervical cancer. We detect HPV 16, yes. HPV 18 and other.
Okay, so, and it is possible to be positive for 16?
And 18 and other, yeah.
Okay, so any combination is
yes.
a possibility?
Yeah.
So now that you've been to molecular,
yes.
When you do the HPV test, if the test comes back positive, then cytology is made. So this is here in the prep lab where we make the cytology slide. This is the ThinPrep imaging system. So it's a computer and it scans the whole slides, and based on an algorithm, it picks up about 22 fields of view. So once the slides have been imaged, they come out here for the screeners to screen. But if there's anything of interest that we might think could indicate an abnormality is present, then we have to look at the whole slide. All the abnormal cells are dotted and then they're referred to our pathologists for reporting.
And we're going to get to see that, right?
Yes, we are. Denise, this is a 26-year-old lady with her first ever cervical screening test, and her HPV was a HPV 16 positive. And because we've looked at the liquid-based cytology and we can see that she has a high-grade abnormality, now this patient would be referred to a specialist for a colposcopy and possibly a biopsy. This particular case, it's a 45-year-old woman. The doctor did give us a history that her last screening test was back in 2014. So this lady is well overdue, and this is what we see under the microscope. And if you look, there is virtually no normal cell. So these are actually cancer cells. So this is cervical cancer. We reported this as squamous cell carcinoma. Before you get into this kind of presentation where it is an invasive cancer, there would be changes like we've seen in the previous slides. But because she hasn't been screened in 6 years, and depending on whether she had the HPV back then as well, it's just a really aggressive form of cancer.
So thank you for showing me all this, because I think for me, it's made me really want to go get a test done ASAP. So I'm very close to that 45-year-old in age, and I haven't had a screen done myself.